All right, on that note, I'm going to call on Cheryl Doran from the Health Council of Canada, and once again, to just reiterate our thanks to the Health Council for sponsoring this event. They were our main sponsor. We've had sponsorship from so many others, which we also graciously extend our thanks to, and Jeremy will come up and mention them, who've helped with all of the other aspects of this. But it's wonderful to have Cheryl here to give us her observations and reflections on the day. Perfect closing.
Thank you. Thank you very much. Well, we have been, I think, privileged today to hear from some of the best minds in Canada on this topic, and what a pleasure that has been. But after listening to everybody, I think perhaps what I have heard is a new version of it was the best of times, it was the worst of times. When the Romanow Report came out about 10 years ago, I think that it pointed to 4 basic pillars that are still there when I listen to the comments today. One was basic values. The second was funding and fiscal sustainability. Third was healthcare quality and access. And the fourth was leadership, collaboration, and responsibility. And those pillars, as you know, arose out of the information that was collected from so many places and people and jurisdictions across this country over the 18 months it took to bring the report to focus. So I want to point that out because it was not only organizations and governments and whether it was people who were in the system, but it was also what was heard from the public, and therefore I would say also from the patients. And that I think is extremely important because what resulted and the recommendations that were made in that report actually did bring to focus the need that we have to be concentrating on the patient and groups of patients. So I'm not going to be able to talk to every point that was made in this room today, but I have about 4 themes that I think I just want to summarize. The first has to do with program directions. And we know, and we heard many references today to the fact that some of the program directions that were set out in Romanow's report basically have been developing quite well. There's been a lot of progress, especially in the areas of primary health care, home and palliative care, somewhat in community health care, public health for sure, and some progress as well, as we know, with wait times, although we have a fair distance yet to go. Where we have not made as much progress, it would appear, is with excluding the BC situation. We still have a lot of work to do with our Aboriginal populations, our rural populations, and certainly the whole issue around pharmaceuticals. And that also leads to some of the final comments today that were made around the social determinants of health, which goes even well beyond the programming references in the Romanow Report. So I think through that, we have gained a better acceptance, a better understanding of the continuum around care and need. So consequently, over the last decade, somewhat starting before, but certainly over the last decade, I think there has been a substantial philosophical change in the minds of government, in the minds of caregivers, and in the minds of the public around the whole issue of the continuum of care. And I'm really happy to see that although there have always been some very good physician leaders in this regard, I think that generally speaking, as a profession, the medical system has now come to that point and is providing organized and informal leadership. And that to me is key, because even if you have other people who are in that mind frame, I think we need the physicians there to be able to be part of that team, and I believe they are now there. So what happens then is that we have all kinds of great examples of what are going on across the country with demonstration projects, with real progress in spots, but what we do not have is a total system. We have not made change at a systemic level, and that seemed to come out very clearly today. So consequently, total transformation has not occurred, and that is where we need to be going. One area that was also emphasized quite a bit today had to do with quality and appropriateness. And some would say these are huge frontiers that we are just starting to approach, but nevertheless, we also have excellent work going on in these areas. It, I don't think, is generally applicable to what is actually happening on the ground. So, and we have some issues there that I think make that somewhat difficult. One is our ability to define and measure things still in a way that's going to allow us to truly understand the issues around appropriateness, for example. And while we are making progress, we are not going to be able to really get this sufficiently on the ground unless we can define and measure. And the other issue in regard to that, of course, is the lack of totality of our information systems. So we do have a ways to go to achieve that as well. The third theme that I want to mention has to do with the federal-provincial roles, but speaking more prominently to what is the actual role of the federal government. And while there was a little bit of debate on that, I think generally the conclusions came down on the fact that we need the federal government to be involved in healthcare in this country. We do need the federal government to be looking at protection of the values of the Canadian public, to basically, in conjunction and cooperation with the provinces and territories, to define appropriate national standards. We need their support and coordination around interjurisdictional agencies, and a number of them were mentioned today, like CIHI, the Health Council of Canada, and others. And we basically also probably need them as well in regard to some of the funding sustainability, although I think it's become quite clear the fiscal sustainability is now more of a non-issue. We have enough money. We now have to use what we have to achieve the kind of transformation that we are probably on the cusp of being able to move toward. And that brings me to the final point that I want to make, which is around the leadership. We know that the delivery of healthcare is predominantly in the jurisdiction of the provinces and territories, but with the kind of roles and overriding roles that can be dealt with in conjunction with the federal government, it really is a shared responsibility. So we do need to get further away from some of the competition that occurs between levels of government and between various provincial governments as well. When Roy Romanow was touring around the country after his report came out about 10 years ago, and he, as you probably all know, traveled extensively and put in a lot of time to try to talk with people and inform them. And at the time I was deputy in Nova Scotia, and he came to Nova Scotia, and as one of his stops, he stopped into the department and sat down with me and some of my senior staff for a while. And I don't know if he would remember this, but after we had a great discussion and we were talking about the directions that we were generally supportive of pursuing, and saying, you know, like this is going to, you know, the way the report came across almost looked like it was going to be requiring some more dollars to invest, and we weren't sure at that time where these accords were going to go, but we know where they went now. The major issue that I had for him, though, was like, how are we ever going to accomplish this kind of transformation? How are we going to be able to see these changes come about that will actually make true change to the health system on a Canadian-wide basis? His answer to me was, I think what it's going to take is for all the premiers of all the provinces and territories to hold hands and jump off the cliff together. Well, ladies and gentlemen, I think we've come a long way. We have come far in the sense of the philosophical perspective we have of where we need to go, on a number of the operational realities that we need to change. And we also need to I think, now start to put some of this in action, but to do so still means, even though we're better positioned, there is still risk involved here. And certainly for everybody involved, and to say not the least, for our political leaders. So I'm going to conclude by saying that I believe that we do have a state of readiness to pursue true transformation. We've got fantastic examples and illustrations of how we can do it. And I believe it's going to take actually leadership at the clinical level, the administrative level, and the political level, all working together. So my final point and final piece of advice is, healthcare leaders, get your parachutes ready.
Wonderful remarks. Thank you, Cheryl, for tying everything together. Okay, I'm going to call on Jeremy to come up and give us some closing remarks. Yeah, did you have a quick comment?
My name is Manuel from North Georgia Hospital. And here's what I'm going to tell my grade 12, my grade 11 son in high school. Normally when I go home, he always asks, Dad, what did you learn today? So this is a quick summary of what I'm going to tell him. I met great people, bunch of problems, bunch of great ideas, a bunch of complaints, and by the way, we all know these complaints for a long time. But it appears that nobody wants to take care and lead this process, and we need lots of doers and less talk. That's what I'm going to tell my son. Second thing that struck me was the agenda, because when I look at the agenda, I saw that we have lots of presentations and only 5 minutes of next steps. For the contrary, I think we should have at least half day of what we're going to do next. All right? Thanks.
Thank you very much. Hello, my name is Jeremy Veillard, and I'm the president-elect for the association. I got to say I'm a very proud president here. I think we had an outstanding day, and I want to thank you, Lilian, you and your team for the outstanding work that you've done today putting this event together. Thank you. It's been amazing. So I just want to start with maybe a couple of personal reflections, and get to tell you that 10 years ago, so I was working for an international organization back in Europe, the World Health Organization, and people got actually very excited when the Romanow Report came out. And I got to say that back in Europe, actually Canada is looked at actually an incredible example of inspirational leaders and landmark reports, and certainly the work of Marc Lalonde and Monique Bégin, the Romanow Report, were part of, the sort of to-do or to read, for the young policy advisor starting in your organization. And I want to say that because, in the true Canadian fashion, that's sometimes something we forget. But we are contributing certainly to lots of discussions in public health and improvement of health, not only in this country, but also internationally. And I think it's been celebrated for the 100th anniversary, and I had the opportunity to meet you at that time, of the Public Health Association of Canada. But it has been a landmark report which keeps on living, among us. So congratulations and thanks for your global contribution. The other thing I want to do, which is always dangerous, is to quote a poet, because we always need a bit of poetry to finish these long days. And this poet is actually a French poet called Jean-Paul. And Jean-Paul said, and I will explain, he said that books are thick letters sent to friends. And I think that's what he means, and certainly your report is a thick report, but it's been sent to friends. And the friends are here in this room. And what he means here is that there's a sender, but there has to be recipients. And there have to be people through which this additional knowledge and inspiration lives, over time. And I think that's what I found very comforting and exciting is the fact that we are all here discussing this report, not thinking that this is something that is, resting on shelves. This is something that, we still look at, look up, try to understand, revisit over time, and it helps us build, the future for the healthcare system in this country. So, so I think that, as one of the friends who have received this report, and I think on behalf of all the friends, I'd like to thank you very much for your work and the team of your work. So thank you. Now I'm here to talk about next steps for this wonderful association, and I think that there will be a few immediate next steps. Talking about friends and future generations, we've tried really to engage the students in this event. So we've done a number of things. Certainly, we've facilitated the the online contributions. But what we have done as well, we managed thanks to a number of partners, and I'll be thanking them in a minute, to get a number of students from across the country here today, and they will have a chance to interact directly with Mr. Romanow for about an hour, and it's going to be their time, and I think it's actually very important that we do that, and I'm very proud that we are doing it. We also have an annual conference, and we attracted more than 600 people this year. It will take place at the end of May, from the 28th to the 30th of May in Vancouver, and the theme of this conference is implementing the triple aim, which is to improve the patient experience of care, improve the health of the population, and reducing the per capita cost of healthcare. And I think that, certainly your comment about, how do we go to the next step and to the roadmap of implementing all these ideas we've been sharing together, we hope, that we'll come with some very tangible discussions at this meeting. And you are certainly all very much invited as this collective of, friends to participate in our event at the end of May. I think that our president, Steny Brown, also mentioned that was the first annual event, and I know that makes you sweat a little bit, Liliane, and I'm sorry about that. But I think that now that we have, in a way, set the tone for having, among friends, these hard conversations and putting things, on the table in a very genuine way, I think I will invite all of you to submit ideas and write to us and, give us suggestions about what we do next and what will be a format that you think will help, move the conversation on healthcare, from the discussion to action and to the roadmap to design the future of the healthcare system in Canada. The last thing I want to do is to thank our partners. Certainly, the Health Council of Canada has been very very supportive. We are immensely thankful. This event could not have happened without you, so thanks for that. We also want to thank a few other partners for their support, certainly for the social media and for the students, and on behalf of the students. So the Canadian Institute for Health Information, the University of Toronto and its Institute of Health Policy Management and Evaluation, CAHSPR, the Canadian Institute for Health Research, the Canadian Foundation for Healthcare Improvement, the University of Calgary and its Institute for Public Health, the University of Victoria, and finally Queen's University Centre for Health Services and Policy Research. These are very precious partners. I think we had outstanding discussions today, and it's thanks to them that we are here. So our greatest thanks, and thanks to the speakers, thanks to you, Mr. Romanow. It's been an honor to be part of this event today. Thanks to all. Good day.